Hello and welcome. Good evening, one and all. I'm your host and moderator, Preeta Harikrishnan, Deputy Manager Admissions, Amrita Health Sciences, Kochi Campus. Thank you for joining us today as you hear the talk on respiratory therapy. This topic will surely give you an insight of the significance of the RPT course. To make sure we are helping you the best, we have the chat box to send your doubts. The doubts will be cleared by the end of the session. So, without any delay, let me introduce you to our special guest, our lovely, young, and energetic Dr. Saumi Johnson. Madam is currently working as Associate Professor at the Division of Respiratory Therapy, Department of Anesthesiology and Critical Care in Amrita Institute of Medical Sciences. She was awarded her PhD in Respiratory Care from Manipal Academy of Higher Education, Karnataka. She was Associate Professor and Head of Department of Respiratory Therapy and Chief Respiratory Therapist and Sleep Technologist at Kasturba Hospital, Manipal. She was the co-chair and faculty at Department of Respiratory Therapy at Inaya Medical College, Riyadh, Saudi Arabia. Madam Saumi was also the chair of the Scientific Research Unit of Inaya Medical College. She will enlighten us with her vast knowledge on the topic scope of respiratory therapy course. I warmly welcome you, ma'am, to address the session.
Thank you, Preeta ma'am, for kind introduction. I do not know if I deserve all these words from you. I thank at the outset the admission Directorate of Admissions, Amrita Vishwapitam, and all the officials of admissions who have been working hard enough to draw right candidates for all the courses. I thank for this opportunity to the Office of the Principal and the Center of Allied Health Sciences and all those brains behind this event. So let me share this screen and my slides. So good evening, one and all again. I hope the participants are majorly the young aspirants who would be joining the allied health courses or one of the courses in Amrita Institute of Medical Sciences. So in this presentation, I would be explaining more about respiratory therapy. But in case if anybody wants to know other allied health courses, I can explain with my experience in allied health sciences courses so far. But my main objective would be respiratory therapy as a profession. So what is respiratory therapy for those who are very new to this profession? Respiratory therapy is not very well-known profession still in India. It's a specialized healthcare field where practitioners are trained in intensive care management. You might have heard about ICUs, CCUs, coronary unit, and ICUs, intensive care units, emergency departments. So we usually work there, and also in the pulmonary medicine department where there is an outpatient unit, both in adult children and the small kids, the neonates. And we treat the patients, we diagnose the problem, those who have lung diseases and cardiac diseases, and whenever required, we also give the treatment and support to the patient. So we say be an RT, choose this profession because it makes a lasting and meaningful differences in the lives of ours. Many times our patients do not know us. That's a sad part of it, because whenever most of the patients, unless you are in the outpatient department of pulmonology, because when they come to us, they are in almost semi-conscious state. They do not know where they are. They are in the emergency department or intensive care unit. They open their eyes and they become all right. And the doctors tell us, yes, patient is fine. Let us remove the tube. Let us take off the ventilator. Patient is fine. Let us shift the patient to another ward or high dependency unit where we just go and see and come. So we are very silent members of the medical team, but makes a everlasting difference in the lives of the patients. Now, what is the need for this profession in India and abroad? This profession, to say, was originally developed in United States of America long back in the sense when we got our independence, 1947. So it's a very long years of history for this profession in USA. But in India, it started in the year of 1995, where Manipal Academy of Higher Education started its first course in bachelor's in respiratory therapy. Then Amrita Institute of Medical Science also started its course. I'll come to that in my upcoming slides. So why do we need respiratory therapists? You might have heard about respiratory therapy, CPAP, and oxygen. What else? Ventilators. More often, when the COVID pandemic was going on, and there was a lot of recognition for the healthcare professionals, including doctors, nurses, and also respiratory therapists. Now, in India, not because of COVID, otherwise also the parliament has recognized, Indian parliament has recognized respiratory therapy as a regulated profession. It was there all throughout, but now it is part of the allied health professions. And there is a paramedical council coming up, and there would be national institutes like All India Institute of Medical Sciences. There would be national institutes where the allied health courses would be taught in all the states of India. And that would go to the central government jobs, state government jobs, like any other profession. And that's about India. Now, Center for Disease Control, CDC, and Prevention identifies 3 of the top 5 leading causes of death as the disease of the cardiopulmonary system. Now, only when there is a need, there would be a profession, right? So if the respiratory diseases were so less, if the cardiac problem was so less, we don't need a lot of cardiologists and pulmonologists. Likewise, the respiratory profession is very good, and then we all stay in the profession because there is a big need, there is a high demand, because we see a lot of diseases, lot of patients with diseases, and CDC, which is the premier organization in the whole world, lists the cause of death, why people die. In the first 5 leading causes, it is cardiopulmonary diseases. So we need people to treat. Now, employment of respiratory therapists is projected to grow 23% from 2020 to 2030. So this is highlighted as one of the few professions where the employment would go very high, which is faster than average of all the occupations. And so you will get job for sure. That's what I'm trying to tell. About 10,000 openings for respiratory therapists are projected each year. This is the statistic from USA. In India, we don't have a very specific statistics, but I can tell blindly that everybody who joins respiratory therapy will get a job, because we have very handful of respiratory therapists in India, because all the students in all the colleges are flying to abroad for green pastures, and we have very less people working in India. That's because you get very highly paid jobs abroad. So each year, on an average, over the decade, so there will be a lot of openings. Many of those openings are expected to result from the need to replace workers who transfer to different occupations or exit the labor force, such as to retire. So now in USA, the profession started long back. So now people are retiring. In India, you can say the average age of a respiratory therapist is, average when you take it will be less than me. it will be like 30, 25. The eldest one would be like 45 or something like that, 45 or 50, nearing 50. That's all. So people would be retiring. Some of them, many of them take medicine, MBBS, because the passion to become a real doctor, or may go into management, research, and all that. So there will be a lacunae of respiratory therapy. So the job prospects would increase. Now, floating controls are coming. Now, it is we say respiratory therapy is a calling. We say, all this nursing, being doctor, all these health professionals are called like, angels. The symbol to depict health professionals during Corona was the angel with the, wings and all that. So it's a calling. If you are a respiratory therapist, it is not just because your parents have put you in this profession. It is also because the God has decided you to become a respiratory therapist, I would say. So helping others in their time of need is a foundation of respiratory therapy. If you see the respiratory therapist, I have heard other people who are not healthcare professionals saying, your students are just sitting there. Your students are just standing there, roaming around in the ICU. I would be very silent to hear that. But if they are needed, they would jump and then help the patient. So we are like that. We just monitor the patient to see that the patients are okay, vital signs are okay, heart rate is okay, oxygen is okay. And then when needed, we help the patient. So that's the, that's why we say it's a calling. We do a lot of service to others. That's the foundation of respiratory care profession. Respiratory therapists make it their mission to deliver consistent, high quality patient care. So we graduate from a college or school. We say school abroad. Here we say college. After BSc, it's not that you end your education there. When you are in a job, whether it is teaching or in the hospital, you have to attend periodic sessions, classes, continuing respiratory care education, continuing medical education. In Amrita also, we have classes for staff and interns. Regularly, they have to update the knowledge. So we give consistent, high-quality patient care. You will find respiratory therapists helping improve the care of the patients at all stages of life, from the newborn, 1 hour born baby, to the last stage, maybe 90-year-old man who is in the end stage cancer. So all ages we can treat, keeping the patient experience forefront as is paramount. So our focus is not the doctor, nurse, or respiratory therapist. We do patient-centered care. The focus is patient. Patient has to improve. Treating each patient with skill, dedication, and genuine care makes the respiratory care profession a vital piece to the entire healthcare profession. So I recently, when I went to give my blood for my routine checkup, they just asked which department you are, and I just said respiratory therapist. So her, the nurse's eye was like wide open, and then she was telling everyone, I felt so proud. She said, in emergency, if they are not there in the head end of the patient, we are so anxious. If they are there, respiratory therapist is there, it's a cool time, like we can breathe well. So it's like that. So it's a very important person when in emergency. I do not know whether they think of us if there is no emergency. Anyway, so coming to the activities of the department here, any college, we do not only participate in the patient care inside the emergency room or ICUs, we do a lot of public health programs also. This happened today. Yeah, it's a coincidental event. So 24th March is TB Day. So these are all my students with the doctors of pulmonology department of our Amrita hospital. So they did some oaths of end TB, and then these are all the posters which my students made. You can see all of them with they did a big flash mob dance and all in the patient OPD outpatient department. So it was fun. Now, we also celebrated World Sleep Day, which was on 17th March. Every year we do celebrate such events. And we had a freshers day for the first years. And you can see the doctors and staff participating in that. We had some invited guests from UAE who were our alumnus, and then they visited the department and then they gave some lectures. So we do participate also in the public health events. For the challenge, there has to be a challenge in the profession. Only then you have fun, right? Otherwise, every day is monotonous. Every day becomes a routine. You have enough challenge for your profession as a respiratory therapist. Respiratory therapy offers great variety and multiple advancement opportunities. In the sense, you just want to be in a cardiac ICU, you can continue your job only in cardiac ICU. Neonatal ICU, yes. Emergency department, you can define your career path. That is the specialty of respiratory therapy. If you are good enough, you can continue. If you want to change the department, or if you want to change the stream, I want to continue in my profession in emergency department for some time, then change to cardiothoracic ICU, cardiac ICU, because you are trained in all kinds of treating patients. So you can change your pathway in between when you get a job. That's what I'm trying to tell. Each day, each experience brings new challenges, making the career of an RT a rewarding path to choose. If you ask me, I don't even have time to think. So when will I get bored of my profession? I don't have a boring situation at all. All the time, things will keep you busy. So it's you get a versatile kind of patients, and then variety of events. And one thing about respiratory therapy is that you have to have a character of lifelong learning. As I told you, what was invented yesterday, they say today things have changed. We have updates most of the months and years, so you have to be update. Respiratory therapy is an art and science taking precision skills to ensure the best care is delivered to all the patients. So we keep ourselves updated. We have conferences, workshops in between, where it's a compulsory thing that the staff and students have to attend to make sure that we are following the state-of-art respiratory therapy. What is practiced in US has to be practiced here also. Things come 10 years later to India, but respiratory therapy, if you see, we follow the books that an American student follows. We study from a book, Egan's Fundamentals of Respiratory Care, which an American student would be studying in America now. So it is the same. So there is a benchmarking. And RT spent years refining the skills even beyond the respiratory therapy program. Each year, RTs continue their education in order to maintain their licensure. So we have a lot of exams to take, small exams, big exams, to make sure that we don't lose on our knowledge. And so I can say that respiratory therapists are lifelong learners. It's a solid career. Though it is evolving profession in India, it has a long history elsewhere in the world. So it's a solid career by now. The profession continues to evolve with the needs of the patient. So COVID was not there before. So when first COVID patient came, that was in Kerala. In India, first patient was reported in Kerala. So they started with the therapy that any a viral fever patient would have, but it sounds to be not effective. Then they had to refine the treatment, and then it took some time to find the vaccination and all that. It happens. So likewise, if something comes up, any disease comes up and treatment does not work out, we have to go with the experiments and then know what has to be done for the patient. So it is continuously evolving, and the profession began with compressed gases and positive pressure devices, and it moved to complex ventilation strategies, extracorporeal gas exchange, community health, and sophisticated pulmonary function assessment. So when I said initially that the profession was started in 1947 when we got our independence, That time we were just giving, the nebulizations for asthma patient. Then there was a poliomyelitis epidemic, like we had COVID. Many patients were not breathing or dying because of polio. That's when the ventilator was invented. It was discovered. So then it was ventilation. Then now at this point, as I showed you some of the pictures where we also do community health, we do work with the pulmonary function test labs. Extracorporeal gas exchange is a very sophisticated one where we don't have any other modality. Nothing is working out for the lung, and the patient may die. Then we change the system to the heart and lung to another machine where the oxygen will be given. So even respiratory therapists can do that. So all sophisticated, up-to-date, state-of-art therapy, respiratory therapists can work. As medical knowledge and technology advance, the respiratory therapists develop knowledge and expertise to support patient needs. So we are part of a team where all the important doctors of the hospitals are there. Anywhere you go, it will be like that. Our RTs are part of the emergency team or healthcare team. So you maybe, if you look at the respiratory therapists, all these photos, I have not shown any old ladies or old men. We don't have any old ladies unless we color the change of our change the color of our hair, because we have very young respiratory therapists in India. But they have enough knowledge to treat a patient. That's what I'm trying to tell. In an emergency, though they are young, they are competent enough to manage the situation. We have to be like that. That's why we have continuous training. So respiratory therapists are in high demand and the profession continue to grow. Now, this was all about respiratory therapy. Let me come to the main point of education option. How do you become a respiratory therapist? So you have many options. Anyway, you have to start from BSc Respiratory Therapy in Amrita Institute of Medical Sciences and many of the famous universities in India. It is 3 years plus 1 year of internship. There are some small colleges where the respiratory therapy is 3 years, but beware of such colleges. You will have to opt for internship elsewhere, and it's going to be very difficult. So choose respiratory therapy where it is 4 years, and this is what is accredited in Canada, America, and Australia, UK, everywhere. They need 4 years of education. And if you are continuing in this profession, if you want to do masters in respiratory therapy, we have that in AIMS, Amrita Institute, also at many institutes like Manipal and Symbiosis in India. We started masters in respiratory therapy in 2010. I must tell you, Amrita Institute started masters first, then started BSc, because at masters level they thought they can be very competent team member. That's what they thought initially, but later on they analyzed the profession and they started our institute started BSc. So now we have both from so many years. So in coming to MSc Respiratory Therapy, we have 4 seats currently. Specializations are adult respiratory care and neonatal and pediatric respiratory care. So adult respiratory care students would be going to the ICU where people more than 18 years, adults, are admitted. Neonatal pediatric is obviously small kids and the ICUs and outpatient departments. Now we are planning to start another specialty because the demand is too high. People wants to join and the seats are less. I hope the admission department would increase the seats for respiratory therapy. We have a queue from last year. We have few students waiting to join Amrita. So we might start another specialty called sleep and pulmonology, which has very high demand outside India now, inside India as well. Now, if somebody wants to branch their career like me to research, you can also do PhD in a doctorate in respiratory therapy, respiratory care, whatever you want to call it as. So now this is the education. Now, if you want to go abroad, you should know that the Indian education, whether it is nurses, respiratory therapists, or doctors, whatever it is, you cannot directly go and work in another country. You will have to write a licensing exam. So, in the respiratory therapy profession, you will have to write two exams basically, CRT, that is called Certified Respiratory Therapist, and Registered Respiratory Therapist, RRT. This is conducted by National Board of Respiratory Care in US. But nowadays, there is something called as migrating or going as a student with student visa to Canada, Australia, and all that. So they get job without this exam itself. But after analyzing evaluating your credentials, your marks and transcript, everything, you will get a very small job. Then after completing this exam, licensing exam, you will get a very highly paid job. Now, in first year, second year, and third year of BSc Respiratory Therapy, we go similar to the MBBS, anatomy, physiology, biochemistry, microbiology, community medicine, and clinical psychology in first year, which is done by the medical college faculty itself, which is one of the best faculty of all the medical colleges put together in Kerala or in India. We are blessed to have a very good group of teachers. Second year, we have pathology, pharmacology, applied science 1 and 2 are the core subjects of respiratory therapy. Third year, basic sciences, applied science 1, and pulmonary rehabilitation. So if you see these subjects, you will know that there is no much difference between what is taught to a MBBS graduate and to the respiratory therapist. You will have to study everything because you are going to look after the same patient, whether you are an MBBS graduate or a respiratory therapist. Your respiratory therapist will look after the patient after 3 years, maybe during internship, but the MBBS graduate will do internship. They might not actually treat that time. They will have to do an MD and then come to the real therapeutic role. So anyway, the education is almost similar. What you focus is important. So after the respiratory therapy course, education, what are you called as? What is your job profile? So you can straight away work as a respiratory therapist in ICUs where any kinds of patients are admitted, like adult, pediatric, and small kids, children, or big people, adults more than 18 years. Or you can work in the pulmonology department where patient come with asthma or any cough, COPD problems, smoking issues, all that. Post-COVID, after COVID, a lot of patients have breathing problem. They come, you check their lung function, give rehabilitation, go home at 5 p.m. Okay, so that is outpatient department. Here in the ICUs, you will have night duties. Or you can work in the pulmonary rehabilitation center itself. You can also become a teacher. You can become an educator in the hospital itself. Or in the colleges, academic position in the colleges like assistant professor, associate professor, or professor. You can also become a research assistant, doing research fellows. You can write all kinds of exams that the Indian government research authority is conducting. You can be a research fellow. You can do PhD under government universities. There are branches. I told you initially, this profession is versatile. You don't have to stick to the same thing every day. After 10 years, you want to change you are not changing the profession, but you want to just see what is best now, what is new. You can keep the respiratory therapy experience and then branch to something else. One thing very popular now is sleep technologist. I also have this sleep technology credentials. So I also look after the sleep patients, where the patient have snoring and then the patient cannot breathe. It's called sleep apnea. So it's correlate, like very close to respiratory therapy. So that's about the profession. So if you have any questions, I would be happy to answer.
Good evening, everyone. I am Sanuja from Admission Office, AIMS Kochi campus. I shall explain to you the admission process of BSc Respiratory Therapy course. Respiratory therapy course comes under Allied Health Sciences. The duration of the course is 3 year plus 1 year internship. And the basic eligibility for this course is the candidate should have a minimum 60% aggregate in physics, chemistry, biology, and English in the +2 level regular course. The admission process for this academic year has commenced. The candidates who wish to join the course can register for the same through our website amrita.edu/admissions. You need to register as new candidate with your email ID and password. There are 5 steps for registration. The first, register with your email ID and password, and the second, enter your personal information. Third, add the application details, and fourth, make a payment of rupees 750 as registration fees. Finally, enter the academic details and upload the mandatory documents as shown in the portal. The application portal is now open and the candidates can register now. The entrance exam will be of objective type and the computer-based exam to be taken at the respective centers closer to you. For each correct answer, the 3 marks will be awarded to the candidate and 1 mark shall be deducted for every wrong answer. The total number of questions of this exam is 80 and the duration of the exam is 2 hours. The syllabus for the entrance exam is based on the syllabus of +1 and +2. For all specialities, selection of candidates will be purely based on the rank obtained in the Amrita entrance exam, AEEL. Out of total seats for all specialities, 50% seats will be allotted to the merit category and 50 to the management category, including NRI 15% seats. Candidates are advised to frequently visit the admission page amrita.edu/admissions for latest updates. The fee structure for this course is for scholarship category, tuition fees is 1,80,000 and other fees is 37,450 and the hostel fees is 68,000. For non-scholarship category, tuition fees is rupees 2,60,000. For NRI category, the tuition fees of $4,500 should be paid. Other fees and hostel fees remain same for all categories. Hostel is not compulsory if the students resides within 20 kilometers from the campus. It should be specially noted that we do not accept any donation or capitation fee for management seat, nor have we appointed any agency or third party for securing admission. For any further query, the candidates can contact the admission office either in the numbers given in the website or send a mail to the email IDs given in the website. Thank you all and over to you, ma'am.
Thank you, Sanuja, for the detailed explanation. Anyway, I'm so sorry if I could not be heard earlier when Soumya madam ended. Could you hear? I had a bit of doubt. Thank you so much for all that good presentation Soumi madam had given us, with all the good, perfect slides that we could grab into every information that AIMS is actually giving us. And the students, the candidates, or even with their parents, I don't know, whoever watching this would surely have decided what they have to go for. So such a beautiful presentation from your side, madam. We are so happy for that. And I hope the students who come over here will surely have your expertise with them, and they will surely come out as very good respiratory therapists here from Amrita. So thanks a lot, and thanks a lot for all who had joined us today, this evening. Thanks, ma'am. Yes.
There is a query. I think it's a direct message to me.
Okay, okay.
Can I read that?
Yes, sure, sure.
Sorry for interruption.
No problem.
Yeah. One person called Samreen Saju had asked, can you tell about cardiac profession?
Okay.
Cardiac perfusion.
Okay.
Whether we have it in Amrita.
We surely have it in Amrita. Cardiac perfusion technology is again a 3+1 year course with 3 years of the study and 1 year internship. You could also opt for that. Okay, when you apply, it is like the exam that we have is a common entrance exam, and like you can make when you after writing the entrance exam, when you are called in for the counseling session, you could give your choice or preference of which program or course you actually want to. So there is no problem. Cardiac professions also, we have very good experts here also. We have that course here.
So he asked me whether I know this profession. So from whatever I know, cardiac perfusion is a high demand job. People will grab you after the course, and then you will be in a very big hospital, because cardiac perfusionist will be working where a very famous cardiac thoracic surgeon will be appointed. So it has to be a multidisciplinary hospital. Multi-specialty hospital in a metro city like Bangalore, Kochi, Delhi. So you will have a very nice life. It's a good profession. Now he also asked to compare between respiratory therapy and cardiac profession, which is very difficult for me. But I can tell you both are good professions. But this has two different pathways. Okay, you join in allied health for many courses. We have a lot of courses. It is called BSc something, respiratory therapy, optometry, cardiac perfusion. But all these are very different professions, and the patients whom we treat are totally different. So you cannot have a comparison. It depends upon each person. In respiratory therapy, you have to be really patient enough, and you have to be very active. We say the students should not have any disability, in the sense we have to stand for a long time. You should be able to work in shifts, night and day. You will have to run in emergency. So you should have enough energy. The basic thing, all that is there. Cardiac perfusion is also like that. You will be working with the cardiothoracic surgeon, where this heart and lung machine will be operated by them, when the cardiothoracic surgery is going on. So it's a very important role, highly paid, I think. And then what I've heard is like it's only few universities have it, and Amrita has it. It's a fortune for all the care like. So that's about cardiac perfusionist. I think you can write to admissions if you want to have more details of this profession.
Okay, so on May 5th, actually, we have the webinar on cardiac perfusion technology. So those interested could also join there. So any other queries? I think I don't see anything else apart from madam. If you have got any other, have anyone sent you any other?
No more.
Okay, so any queries you have, you could please you could write, you could mail to ugadmissions@amrita.edu. You can go to the website that is given the chat box, and you get all the details over there. For any other queries, you could even contact us. The phone numbers given in the website. So thank you once again, ma'am, for being with us, spending your time with us after so long, busy schedule of your profession today, and then giving us such a lot of time. That shows how much you want them to know about respiratory therapy and people coming up to join. Thank you so much once again, all of you, for joining us today. So that comes, then we come to the end of the webinar today. Thank you.